Hi, Quinlan. I'm Heather. I'm your nurse today.
I'm worried about my hand.
No, okay. I'm just going to take some notes, okay?
Sure.
Does it hurt?
Yeah.
Okay. So you've got a sore hand. If 0 is no pain and 10 is the worst pain you've ever experienced, what would you rate your pain at in your hand right now?
It's like a 7, I'd say.
A 7, okay. Okay, 7. Does anything make it better?
No.
Nothing makes it better. Does anything make the pain worse?
Yeah, like moving my hand around, or if I touch the wound, it hurts.
Okay, can you tell me about the pain?
What do you want to know?
Is it stabbing? Is it throbbing?
It's like a throbbing pain, I guess.
Throbbing pain, okay. Does it go away?
No.
So it's there all the time, it's
Yeah.
just always throbbing, okay. Can you point to exactly where your pain is?
Yeah, just right there.
Just right in the corner of your hand?
Yep.
Okay. Does the pain go anywhere else? Up your fingers, down your wrist?
No.
No, okay. When did it start to hurt?
When I injured my hand, I guess, is when it started hurting.
Okay, and when was that?
4 days ago.
4 days ago you hurt your hand, okay. What did you do?
I accidentally stabbed it with a screwdriver.
Okay. How did you stab it with a screwdriver?
Well, the screwdriver was in my pocket, and I just went to put my hand in my pocket and accidentally did that.
Okay. Okay. Do you have any problems with your breathing at all?
No.
No. Do you smoke?
Yes, I do.
Or how much do you smoke?
Half a pack a day.
Half a pack a day. So you smoke half a pack a day. You hurt your hand 4 days ago when you hit it with a screwdriver.
Right.
Okay. Oh, that looks really bad. It looks infected. Is it okay if I just put the gauze here? Okay. Okay, I just got to write down a little bit about this. Okay.
Please state what you are doing and what you are looking for.
Well, I'm looking at the wound, and I can see it's red, and I can see there's a large open wound. It's bleeding, and I can see there's some green drainage on the gauze, so I would think it's infected. So I just want to write that down so I can remember that. Okay. I'm just going to check his pulse, make sure there's circulation to the hand.
Pulse is 98.
Okay. Can you wiggle your fingers for me?
Sure.
Okay. This really looks bad, Quinlan.
Yeah.
Has it always looked like this? Like, did it look like this when you...
No, it didn't really look this bad until last night.
Last night. Okay, why didn't the doctor close that wound when it first happened?
Well, I haven't seen a doctor.
Well, why didn't you see a doctor when you did this?
I don't know. I didn't think I needed to.
Well, you can see now it's infected, and you should have been seen by a doctor to have some treatment done.
I guess so, yeah.
Okay. So, I can see some swelling around the wound too. Does it hurt when I touch it?
Yeah.
Okay. And I can see the green drainage. So there's green drainage on his gauze, which tells me that that wound is infected. So I'm just going to put my gloves in the garbage. Okay. Okay, so it's green. I'd like to do a set of vital signs, please.
Blood pressure is 128/82. Pulse is 98. Temperature is 38.6. Respiratory rate is 16. O2 sats are 98% on room air.
Could you repeat those for me, please?
Blood pressure 128/82. Pulse is 98. Temperature is 38.6. Respiratory rate is 16. O2 sats 98% on room air.
There is 1 minute remaining with the standardized client.
So the patient has a fever, so I would call the doctor.
The doctor will arrive in 15 minutes. Please continue with your assessment.
Okay. Quinlan, where do you work?
Home Depot?
At Home Depot. Okay. And do you take any medications at all?
No.
No medications. Okay. Do you use any other drugs? Like, do you use any street drugs, any marijuana, anything
No.
like that? Nothing like that. Okay, but you do smoke.
Yes.
And you have a fever now. And you haven't taken any medication? Okay.
No.
Okay. So his pulse is elevated and his temperature is elevated, so I would just, we'll wait for the doctor to come. Do you have any questions for me?
No.
No? Okay. So we'll just wait for the doctor to come, and he'll take a look at your hand and get that fixed up for you, okay?
There are 4 minutes remaining in this station.
Please stop. You have 4 minutes to answer 3 questions. Quinlan has an infected wound and will start on antibiotics. What information should be given to Quinlan before he leaves the urgent care center?
Okay. So it's infected, and he's going to start on antibiotics. And what should... Can you just repeat that question again? Sorry.
Quinlan has an infected wound and will start on antibiotics. What information should be given to Quinlan before he leaves the urgent care center?
So because it's infected and he's going to start on some antibiotics, before he leaves the urgent care center, I need to tell him to have the prescription filled, and then he needs to take all of his antibiotics, and then if he's got any questions, he should come back and ask us.
Quinlan returns to the urgent care center and tells you he now has nausea and vomiting and cannot tolerate the antibiotics. What should you do?
So I think he's got the nausea and vomiting because of the antibiotics. So I would assess for the intolerance to the antibiotics, and then I would tell him to take Gravol about 30 minutes before he takes antibiotics, because Gravol is an antiemetic and it might help settle his stomach.
The wound will require an incision and drainage due to the infection. The physician wants to film the procedure to show to medical students. What is required prior to any filming?
So if they're going to film it, they'd have to have some equipment there to film, so they'd need the proper equipment. And then I would remind the doctor that he should just tell Quinlan that they're going to be filming the procedure. Could you repeat the last question again, please?
The wound will require an incision and drainage due to the infection. The physician wants to film the procedure to show to medical students. What is required prior to any filming?
Okay, so the incision and drainage is an invasive procedure, and it's to teach medical students, so it's going to be for teaching purposes, so that's okay. So yeah, I just make sure that the doctor tells Quinlan that they're going to film them doing the actual incision and drainage.
Please proceed to the next station and begin reading your instructions.